Good evening, everybody. I am Dr. Dhruba Roy, consultant gynecologist and obstetrician attached to Fortis Hospital. On behalf of HCAH, I wish all the lovely ladies across the globe a very happy and healthy Women's Day. This year the theme is break the bias. Bias means we should not be biased about our problems and all. We must come out of it and we should talk about it. We must not hide anything. We must be leading a very healthy life and enjoy life and celebrate life. Today's lifestyle, hectic lifestyle and the stress of life needs all the women to have regular health checkup. First of all, we should have the clinical health checkup like blood pressure, blood sugar checkup, because nowadays even the young children may be affected by diabetes. So blood pressure checkup, mental, that is also very important, stressful for all of us. So not only having any gynecological problem, general health checkup is very important for all of us, like checking the blood pressure, blood sugar, thyroid profile test. Otherwise, 20 to 30 years age is the age of marriage. So premarital hemoglobin electrophoresis to rule out the thalassemia. Thalassemia screening is important, and the blood group, all these things should be tested. And if the patient is obese, if the lady is obese, for obesity, we should have some lipid profile test. If there is some menstrual irregularities, so we have to add certain tests. And regarding cancer screening, cancer is very much nowadays predominant in every family. It has been seen that almost one or anybody is affected in almost all families. So if there is family history of ovarian cancer or breast cancer, they should be more alert. There is breast self-examination that should be done routinely, and it should be done by every lady, not daily, but frequently, every 1 or 2 months, like that. And cervical cancer screening by pap smear. American Society recommendation is every 3 years, cervical pap smear test should be done. And if there is any family history of ovarian cancer, they should do one pelvic examination or ultrasonographic examination. These are the basic tests should be done regularly. Next, we come to breast cancer. As the name suggests, breast cancer is the malignancy of the breast tissue. It may present with a breast lump, painful lump, or sudden increase in size of a fibroadenoma. Some breast lumps are benign. But if the growth is very sudden with pain and all, if there is abnormal discharge from the breast, or if there is ulcer, especially around the nipple, bilateral ulcer, which is not getting cured by medication, like Paget's disease and all. So these are the conditions which may turn into breast cancer. So we should be careful about it. Any cancer, if detected earlier, especially uterine cancer, breast cancers, throat cancers, and other blood cancers, few cancers are there which are detected earlier, can be detected. Like in case of breast cancer, it can be detected earlier by breast self-examination by the person herself. So if it is any lump is felt, he or she should be immediately contacting a doctor. I am saying he because breast cancer is common in male also. Today we are not going to discuss about male breast cancers. So breast self-examination is very important, and below age of 45 years, we can do ultrasonography of the breast, and after that age we can do mammography or X-ray, high resolution X-ray of the breast tissue. That can also detect the lump, and if the lump is big, before going for operation, there can be done fine needle aspiration cytology of the breast tissue or true cut biopsy or excision biopsy of the breast lump. If it is benign, fine. If it is malignant, proper treatment should be thought of planned. So if it is detected early, usually cancers are divided into 1, 2, 3, 4. 4 is the last stage when other organs also involved, like brain metastasis, liver metastasis in distant organs. When the tumor has metastasized, then the treatment is a bit complicated. So you have to treat all other organs too. But if it is, when it is located inside the breast tissue, in early stage, not going to the lymph nodes and all. So treatment is easier. Nowadays it is done MRM, modified radical mastectomy, or mastectomy with axillary clearance. These are the treatments of breast cancer, and subsequent treatment depends on the biopsy report and immunohistochemistry or PET scan that is taken care of by the oncologist. So breast cancer, if it is detected earlier, it can be cured, like uterine cancer, cervical cancer. If they are detected in stage 1 or 2, they are cured, absolutely cured. Normal healthy life can be passed on. And ovarian cancer, detection of ovarian cancer is a bit difficult because the silent lump, there might not be any problem or complaints. Whereas in case of cervical cancer, cervix is the door of the uterus, the lower portion of uterus. Like if we consider this is the uterus and this is the cervix, cervical cancer, uterine cancer, they produce symptoms in early stages. Like in case of uterine tumor, there may be irregular bleedings. In case of cervical cancer, there may be offensive vaginal discharge, or there is irregular bleeding, intermenstrual bleeding, spotting, etc. may be there. So if these symptoms are taken care of, investigated thoroughly, the cancer can be detected earlier and treated accordingly. If it is confined to this area, by excising this portion, the cancer gets cured. But this cancer, if it is detected late, when it has gone to here and there, so then it becomes a bit difficult. Stage 3, 4 stages, though treatment is there, chemotherapy, radiotherapy, so many treatments are there, then too, if it is detected earlier, so treatment becomes much more easier, like uterine cancer. So these are completely curable if it is detected earlier. So patients should be concerned, and they should consult their doctors even if some early symptoms are there. But in case of ovary, sometimes these grow silently without creating any symptoms. But there may be weight loss, there may be anemia, indigestion. The ovarian cancer may present with these also. These digestive problems, digestive system problems. So one pelvic ultrasonography or whole abdomen ultrasonography may detect early ovarian tumors, or usually ovarian malignancies are partly solid, partly cystic. Whereas we confuse with polycystic ovaries. Polycystic ovaries are not tumor or cancer. It is a different thing, completely different entity. So if any cancer, if it is detected earlier, it can be treated properly and patient can be cured completely. So there are so many menstrual disorders which gives anxiety to the patients. I see many patients who are concerned about not having their periods for 45 days or 50 days. But it is to be kept in mind, periods may come every 21 days or may come every 45 days. That is normal. Coming less frequently is not a disease unless the patient is very obese or there is having polycystic ovaries. But coming more frequently, say around every 15 days, 18 days, prolonged bleeding, heavy menstrual bleeding, which is causing anemia, these are more serious, that is to be investigated thoroughly. In case of less period, if the period, when the period comes more than 3 months interval, then also it should be taken care of. But every 45 days, every 50 days, if the period comes, it is not an issue, it is not a problem. Then too, when they are worried, anxious, we should counsel them properly and tell them it is not a problem in case of having less period or scanty period. Polycystic ovaries will come later on. Menstrual anxieties, there are puberty, initially there may be excessive bleeding, that is called puberty menorrhagia, which settles on its own within 2 years of menarche. That is not an issue. But if the menstrual irregularity, mainly more frequent periods coming every 15 days or ऐसे कि 20 days का कम gap में आ रहा है, in that case we should thought of some problem, and hemoglobin estimation should be done, whether the patient is having anemia by having excessive bleeding, and ultrasonography obviously may see what is wrong with it. And in case of say above 50 or 45 years, when the endometrial thickness is more, or in menopausal women, if the endometrial thickness is more than 4 millimeter, we should think of something which that should be investigated properly. But in case of young age, one ultrasound will suffice. If there is no problem in uterus or ovarian tissue, we can keep it, the thing will correct its own spontaneously. And anxieties, first thing, anxiety, patient may become irritable, anxious, insomnia, they might have all these things, say around 10 to 14 days before starting the period, or pain may be there. Pain is a big issue. If the serious pain is associated with endometriosis, we have to rule out whether the patient has endometriosis or not. And regarding the mood swing, we should give them some mental support, mental health support, and some simple vitamin supplementation sometimes help them to overcome the anxieties. And many patients or most of us are nowadays see that they are vitamin D deficient. These vitamin D deficiency is related with almost all the problems in our body, starting from weakness, bone pain, mood swing, everything. So we can go for vitamin D testing or B12, folic acid, whether they are deficient or not, we can see. And if the patient is having excessive bleeding, we have to rule out any thyroid problem, etc. So anxiety, if it is just functional, no problem in uterus or ovaries, it should be cured by just counseling and supplementation of a few vitamins, folic acid, pyridoxal phosphate, vitamin B6, etc. And menstrual hygiene is very important so that menstrual infections doesn't happen. Infertility is when a woman trying for pregnancy for 1 year and having regular intercourse but not having baby, or any woman above 35 years trying continuously for 6 months but not having pregnancy, they are called infertile or subfertile women. The causes are a lot. Most of the causes may be anovulation, ovulatory problem, may be defect in the tube. Ovulation defect means the ovums are not coming every month. It is not secreted by the ovary. There may be block in the fallopian tubes, which the ovum cannot be picked up by the tubes. There may be problem inside the uterus. The uterus cannot receive the fertilized ovum properly, or it cannot hold it, it goes out, or there may be local infection, obstruction, etc. There may be endometriosis, which hampers the tubal motility, or there may be male factor defect like azoospermia and all may cause. Azoospermia means no sperm in the male partner. These things may cause infertility. It has to be investigated thoroughly. The name suggests itself, the infections which are occurring after having intercourse. Various infections are there. HIV, various viral infection like human papilloma virus infection, herpes simplex viral infection, HIV infection, hepatitis infection, and bacterial infection like bacterial vaginosis, gonorrhea, chlamydia. So many infections can happen after having sexual intercourse. So it has to be, if the person has multiple sexual partner or maintaining a hygiene, proper hygiene, these are the things should be thought of. Bacterial vaginosis, this is very common. What happens in bacterial vaginosis? There are some good bacteria inside the vagina or some bad bacteria. When the good bacteria are there, they prevent all sorts of infection. They prevent all sorts of infection. But when the bad bacteria take the upper hand, then there are a lot of infections occur. So this is called when the bad bacteria. Bacterial flora is the certain bacteria which prevents infection by the pathogenic bacteria inside vagina, genitourinary tract. Those are called commensal bacteria or bacterial flora. When the balance is lost, there is chance of various infection. Ideally, premenopausal women have acidic pH. There is lactobacilli, which is stimulated by estrogen. All these factors prevent vaginal infection or urinary tract infection. But in case of menopause or when there is estrogen deficiency, or in those cases, there is more chance of this sort of infections. Any maternal or fetal condition which may adversely affect the pregnancy may be considered as high-risk pregnancies. Pregnancies associated with, suppose, diabetes, hypertension, or any other disease, thalassemia, thyroid disorder, which may adversely affect the fetal outcome, that may be called as high-risk pregnancy. Similarly, multiple pregnancy, previous history of congenital defect in the baby, and RH incompatibility, all are high-risk pregnancies. Usually, most of the pregnancies are normal, but because nowadays most of the persons or ladies getting pregnant late, there is more chance of having diabetes, hypertension, and all these complications. So there is more incidence of high-risk pregnancies nowadays. So 25 years around, this is the best age for having pregnancy. The complications are less at that age, but after 35 years of age, there is more chance of complications. So any complications which may adversely affect the outcome of pregnancy will be considered as high-risk pregnancy. Polycystic ovarian syndrome, it's a diagnosis, medical diagnosis. It's a complex presentation of having scanty periods. Patient may be having the features of hyperandrogenic features like hirsutism, excessive hair growth over the face or unwanted places, and there may be black spots over the neck and insulin resistance, all these things. And when we do ultrasound, there may be polycystic appearance of the ovaries. That is called polycystic ovarian syndrome. Polycystic ovary, not all the ovarian volume should be increased. That is a radiological diagnosis, polycystic morphology of the ovary. That is not serious issue. It is not a cancer. It is not a tumor. It is a metabolic disorder. It is a lifestyle disorder. Lifestyle modification is the answer of polycystic ovarian syndrome. Usually sedentary lifestyle, having all the time fast food. These are the provoking factor. So we'll have to have healthy lifestyle, regular exercise, avoiding fast food. That may help to overcome this polycystic ovarian syndrome. That means periodic irregularities, and these will be overcome. See, menopause means the patient will stop having menstruation and there will be estrogen deficiency. Estrogen, progesterone, these two hormones mainly balance, keeps the balance of the lady throughout her reproductive life. But after menopause, there is estrogen deficiency. Estrogen is very much important sorry, to maintain our bone health. Bone मतलब हड्डी का health, bone health, cardiovascular disease prevention, mood swing, all are related to our estrogen deficiency after menopause. Estrogen, after menopause, estrogen is secreted from the abdominal fats and all. It is a weak estrogen, estrone type, very weak, not estradiol. So, first 10 years of after menopause, if not contraindicated, estrogen supplementation is important to prevent all these menopausal issues. Mainly fractures and all, osteopenia, osteoporosis, these are more common after the age of say 50, 60 years. So bone mineral density test can be done to see whether the person has osteopenia or osteoporosis. And after menopause, again the mental health issues like anxieties are increased, anxiety, insomnia, hot flashes, irritation, irritability, everything increases after menopause. So proper counseling, help from the family, and regular checkup, everything is important. Checkup in the sense blood pressure, blood sugar, lipid profile, and cardiac checkup, these are important. And of course, cancer screening by cervical pap smear, that is also very important. Vaginal infection means infection of the genital tract, lower genital tract, the birth passage infection. And UTI means urinary tract infection. These are two different things. Vaginal infection is this is the vagina infection over here, whereas bladder is a completely different organ. Urinary bladder infection, that is called UTI. These are two different infections. UTI or urinary tract infection mostly occurs by E. coli bacteria. It comes from the intestine through fecal matter. So from the fecal matter, it as E. coli ascends through the perineum, goes inside the urethra and goes in the bladder and causes the infection. Most of the cases, it is the E. coli infection. Other bacteria can also cause infection, Klebsiella, etc. So how can we prevent urinary tract infection? By maintaining local hygiene, frequent passage of urine. While using commode shower, it is very important. It should be used from forward to backward, not from backward to forward, so that the stool, fecal matter should not come in front. It should go behind. So that is very important to prevent and maintain the hygiene. And postmenopausal women are more prone to UTI because of estrogen deficiency. So estrogen supplementation or even using estrogen cream around the urethra can prevent to some extent the urinary tract infection in case of old age. it is very common due to estrogen deficiency and vaginal atrophy, and the lactobacillus that prevents the infection, that is also less in menopausal women. So first thing, estrogen supplementation, have adequate fluid intake. If not contraindicated, like renal disease, unless someone has renal disease, they can have 2 to 3 liters of water daily, and you can use the progesterone gel. All these things can prevent urinary tract infection. So whenever you visit a gynecologist, apart from discussing about your gynecological problem, like menstrual irregularities, like having excessive period, I repeatedly tell, having excessive bleeding is more dangerous than having scanty period. Scanty period or not having period, first exclude pregnancy. Suppose someone is not having period for more than 2 to 3 months. First, if married, you exclude pregnancy. After that, you think for other things like polycystic ovaries or other things. But having excessive bleeding may be associated with fibroid uterus or any ovarian tumor, germ cell tumor, etc. Having excessive painful bleeding may be associated with endometriosis, adenomyosis. So they should be taken care of thoroughly. Ultrasonography nowadays, it is so useful, and simple ultrasound can detect so many problems. Sometimes ultrasound is showing everything is normal, but while doing parvaginal examination, we can detect certain polyps, some unhealthy cervix. So to detect the cervical problems, we have to do parvaginal speculum examination. So internal examination is very important for any gynecological problems, and breast problems, especially those who are having family history of breast cancer or ovarian cancer, should do the regular screening test. One screening test is cervical pap smear every 3 years. It is recommended by HCAH, American Society. It's starting from 20 years up to 60, 45, 50 years. You go on doing every 3 years. HPV testing is not routinely done. Human papilloma virus vaccination is available nowadays. If sorry, HPV infection may cause vaginal warts, vulval warts, etc. And HPV virus strain 16 and 18 may cause cervical cancer. So cervical cancer prevention, for this vaccine is available in the market against these strains of HPV 16, 18. Nowadays, one vaccine is available which is active against 7 strains of HPV virus. So vaccination can prevent cervical cancer. It is in market. So these are the prevention is better than cure. We should take care of our health before going to a point of no return. We should take care at the earliest. We should not be negligent regarding our health issues. We should take care of ourselves. So break the bias, be careful, stay safe, celebrate life. Thank you.